How are you? And we're gonna have an interesting topic today. Are you ready for it? This is what you always talk about. You ready?
Shit.
I'm ready. Healthcare horror stories. Lessons learned from benefit blunders. This would be a perfect October show, not a June show. Can you share one of the most memorable healthcare benefit horror stories you've encountered and what lessons were learned from it?
Sure. I've had a couple. One, they sell these minimal essential coverage plans, item, or these Christian mango plans, like living on a prayer. So the particular, the first one was this young lady was hiking out west in Washington, and they had the living on the prayer plan, the Christian health insurance plan, and she took a rock. They were rock climbing. Her boyfriend was ahead, and he kicked a loose rock and hit her right in the head. And she had to go to plastic surgery, all kinds of stuff. But she had that Christian stuff, and they refused to cover her because they were engaging in a hazardous sport.
Oh, yeah.
So she's sitting there and she needs surgery the next week. But fortunately, they were self employed and it was like the 26th of the month or 25th of the month when I found out. And I said, okay, here's what you do. You can get surgery on the second. She was from Idaho. So we got her a Blue Cross from Idaho PPO plan, gold plan, and her surgery. And she actually was a silver plan because they didn't make much money. So she got all the subsidy and got a zero deductible. And her 30,000 she would have been out of pocket with zero. But Christian plan, the agent was like, oh, that's just the way it goes.
Oh my goodness.
So it's 30. So another good one is this lady here in New Hampshire got COVID and she was hospitalized for a month. She was on, her bill was like, ended up being, they said she owed like 70, 80,000, I think it was. But anyways, because the minimal essential plan covered a little, but she was still owed $80,000. And I was like, you're lucky you called me because they said there's nothing they could do, both the hospital. And so I get the hospital line and I go there for COVID, the Health and Human Services grant for COVID. Have you applied? No. So they did, and the whole 60, 70,000 was wiped off. Now, this is how smart that company was. They, I did not even the agent, and I bailed them out. They had an Aflac agent who wasn't even the agent either. I got in, they got me involved, and they didn't listen to me to use fully insured ACA qualified plans. They kept the minimal essential plan. That costs more. And I just started laughing. Oh, you guys haven't learned your lesson, have you? Yeah.
It's
Then I
it's
had,
yeah.
yeah. Then another good one was I had a buddy I golf with, and we're on the golf course. He's telling me he owes $48,000. He's paid like 20,000 because he has VA benefits, and he had a heart attack, and he was over at this hospital. And I said, "Whoa, it's an emergency. No, your VA should have covered that." So I got the hospital on the line, and they sent him a check back for 20 some thousand that he had paid and wiped off. He owed nothing now because they didn't file it to the VA. They screwed up the hospital. But see, people don't know this.
Yeah. But that's why you're a healthcare expert, Tom.
So
You
I
well,
sat there. Yeah. So those are three pretty good
yeah, they are, and
stories.
it's scary, and a lot of it involves the individual, and that's one thing that people sometimes don't understand. If you're an individual that's self-insured or go and paying too much on their healthcare and not have an employee's benefits plan, contact a self-employed, maybe only have one other employee, contact Tom. Tom will hook you up, and it'll cost you minimal, and it's gonna save you a lot. And that's the key thing. And then if you're paying a lot for your employee benefits plan, and you're paying a lot out of pocket and you're not a company, you're the individual, you got to go to that company and say, guess what? You need to talk to Tom. All right. So here's one thing that I think that's so important for employees to not understand. The bottom line is productivity for your employees means making more money as an owner. So how can poorly managed benefits programs negatively impact employee morale and productivity?
If you have a $5,000 deductible and you ask the employee that the employees have to pay the first 5,000 and they have a hospitalization, that costs the employee $2.41 every hour they work for you. If they work a 40-hour work. On top of that, you're asking them to pay $300 a month. And, there's another buck, whatever. At least that one's pre-tax. And most people, the 241, they're not funding it through their health savings account or a flexible spending account because most small businesses don't have a flexible spending account because the HR director or the office manager thinks that would be just too difficult to allow people to get dependent daycare and other stuff covered because of the use it or lose it mentality. So those are things that, and you don't ever have to lose it anyways. A small business owner can give you a check for what you didn't use. It will be after tax. So what? I mean, it's just insane what people are not doing because they're allowing some person who's worked there for 6 months who takes a smoke break every 15 minutes to make a decision on their health insurance. Makes a lot of sense. Watch it.
Could you give me an example of a company that unintentionally created significant financial hardship for its employees due to
Sure.
benefit mismanagement?
That happens every day. Any small employer under 50 that doesn't allow has what's called an affordable health plan are hurting their employees. They should not have an affordable health plan on paper. What they should have is an unaffordable to allow their employees who want to get subsidies on the state and federal exchanges, depending on where they live. The employer that can cover their deductibles on a bronze plan and give their employees better benefits who choose this option because it's voluntary. So literally there's people, they're paying 3,000, they're asking their employee to pay 1,000, they're paying 2 every month. And then those employees could be paying 0 because their premiums could be closer to 0 than 3,000 because of the tax breaks they're eligible for. And if you have fewer than 50 employees, there is no employer mandate companies. What are you doing? Secondly, large companies, the dependents now can get subsidies. Why aren't you letting them all know this? The employees don't, but the dependents can. Why wouldn't you do the same thing? I have no idea.
When you tried to swim into those waters with over 50 employees, Tom, is it harder to have them listen to what
The
you have?
problem's the HR directors. They have relationships with the current agents. Think about it. I have one right now. They're losing about 2.5 million a year by not listening to me right now. And literally the HR director the agent did a PowerPoint about our solution. Yet they never were told what we were even going to recommend to them. And the HR director sitting there going, it's 2.5 million. First of all, you should have no, shouldn't even be involved. Second of all, I'm just laughing. So my question to the owner and the CFO is going to be, listen, you have $2.5 million you're giving away right now in claims because they're self-funded, and you don't have to. Was this guy more important than 2.5 million? And on top of that, your benefits suck. They don't even cover specialty drugs, meaning somebody who needs an injectable is on their own. Their benefits suck. And they're sitting there he's trying to poke holes in our solution he'd have to explain that. It'd be a good podcast, but I would advise him never to get on a podcast with me. Probably.
Wow. It's amazing what happens. What are some hidden pitfalls in healthcare plans that employers might overlook but can lead to disastrous outcomes later on?
Repeat that. I'm sorry.
Yeah. So, what are some hidden pitfalls in healthcare plans that employers might overlook but can lead to disastrous outcomes later on?
Well, I mentioned a couple once who try to, the groups above 50 tried to skirt the employer mandate penalty and put in these minimal essential coverage, touting them as qualified health plans under the ACA, which somehow, some way they are, but it makes no sense. Trying to get people to buy Christian plans. Those Christian plans, if you're going to go to that extreme, do an ACA plan and let them get subsidies. They pay less than even those plans. So it's just funny to me how people they trip on Benjamins to save pennies.
Let's break down. We talked about this in another podcast, but I think this relates to some of the horror stories. Is that if you're a business owner and you're looking at healthcare and you're looking at the bottom line of the costs up front versus the costs that could end up what you're going to pay long term, you would see how ClaimLinx is a better option because ultimately you're going to save, yet your employees might get way better benefits and you might be paying for more things for them, but it's not going to cost month to month as much and deductible wise, right? Explain that part. Yeah.
What people don't understand is we're just doing the math on the insurance plans, showing the business owner that they're better off to self-fund certain items than buy insurance for it because the insurance companies have it priced such that even if everyone uses it, you still lose. So you could never lose with what we're doing. You, we only get paid if you sing on the consulting side. So literally you can't lose. It's just a matter of how the benefits then. So if you're saving 1,000 per employee and you can take on a little more risk, so now you can lower their out of pockets because you're guaranteed to save. You can do things like I mentioned before by making your plan unaffordable if you're a small group and allowing dependents, making it unaffordable for them on the employer plan. And then those who don't choose it, you simply give them a raise and you run it through this premium only plan, which rides under a tax law, section 125. So all I'm doing is showing people that you can't lose because of math. Math doesn't lie.
Okay. How can businesses identify and rectify mistakes early before they escalate into bigger problems?
They have to understand the plans they're buying. The problem is on the larger groups, they're buying these, like I mentioned, self-funded plans and they don't cover specialty drugs. Who's that help? That
No.
hurts. That hurts. Do you think that's good for employee morale? Yeah. Not another big one is you got these Aflac and Colonial and other companies. If you buy their products, you lower the payroll for most products, not all, some of them, but you're helping the employees. And if the employees are paid for it, why would you not allow them to have that choice? And for working for you, some of the people who have conditions can get it because they have relaxed underwriting standards for having a group guaranteed issue and other things. Why would you not do that?
That makes no sense at all.
It's because they have allowed somebody in their organization to make decisions where it's not their money and they are the most emotional people. And if math is an unemotional subject, it's an answer, right? no emotion. Why would you, on a math problem, have the most emotional person and the person whose bottom line, it doesn't matter to you, make a decision? It makes zero sense.
So if you're an owner or an HR director right now, and you just look at the health benefits as a horror story, how can they identify they're on the wrong track? Because a lot of people just don't or just don't know. When we
You
say
got to be able to look in the mirror and say, I'm willing to listen for 10, 15 minutes to see if I can save money on my health insurance and provide better benefits for my employees. And if they can't do that, unfortunately, you get what you deserve.
best place to go, claimlinx.com. Appreciate it, Tom. Talk soon.
Thanks.
Special simulcast, The Neil Haley Show, and The Cutting Edge